So if we look at California, these numbers are from yesterday. We have 33,865 COVID cases out of a total of 280,900 total tested. That's 12% of Californians were positive for COVID. So we don't, the initial, as you guys know, the initial models were woefully inaccurate. They predicted millions of cases of death, not of prevalence or incidence, but death. That is not materializing. What is materializing in the state of California is 12% positives. Well, if we have 39.5 million people. If we just take a basic calculation and extrapolate that out, that equates to about 4.7 million cases throughout the state of California, which means this thing is widespread. That's the good news. We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. 0.03 chance of dying from COVID in the state of California. Does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate people being out of work? So if this is a typical extrapolation, 328 million people times 19.6 is 64 million. That's a significant amount of people with COVID. It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu. And we had a similar death rate. The deaths in the United States were 43,545. Similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States. Every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home. Severe disruption for accelerated as we have people coming in 7 in the morning till midnight. We're reporting to the health department, we're calling patients back, and at the same time our volumes have dropped significantly. The hospitals, their ICUs are empty essentially, and they're shutting down floors. They're furloughing patients, they're furloughing doctors. So the health system has been evacuated in certain places. In New York, the health system is working at maximum capacity. In California, we're really at a minimal capacity, getting rid of our doctors and nurses because we just don't have the volume. The hospitals don't, as I've met with their CEOs twice in the last week, and we don't as well. We're sharing our own data. This isn't data filtered through someone. This is our own data. We found 6.5%, and then California has found 12%. So the more you test, the more positives you get, the prevalence number goes up, and the death rate stays the same. So it gets smaller and smaller and smaller. And as we move through this data, what I want you to see is millions of cases, small amount of death. Millions of cases, small amount of death. Let's go over their numbers. Cases of COVID as of yesterday, 256,272 cases in New York State. Not New York City, New York, the entire state. They did a total of 649,325 tests. That's 39% of New Yorkers tested positive for COVID-19. That's their ratios. This is public data online. You can all look it up.
39% of people who were tested.
39% of the people were tested.
39% of New York State.
Right.
39% of New York State is there's 20 million people there would be close to 4 million.
Which is likely, they likely have 7.5 million cases in New York.
I just want to make that clarification. It's not 39% of every New Yorker, it's every New Yorker who's been tested.
Right, so we extrapolate data.
I just want to make that.
We extrapolate data, we test people, and then we extrapolate for the entire community based on the numbers. The initial models were so inaccurate, they're not even...
But in those initial models, a lot of them were based off if we did no social distancing.
Right.
Is that correct? So is it really fair to say, obviously they're not as bad as they were because those were based on alternative scenarios?
And some of them were based on social distancing and still predicted hundreds of thousands of deaths, which has been inaccurate. So in New York, the ones they tested, they found 39% positive. So if that's indicative, and they tested 649,000 people, that's a massive test. That's accurate data, 39%. So if they tested the whole state, would we indeed have 7.5 million cases? We don't know. We will never test the entire state. So we extrapolate out. We use the data we have because it's the most accurate we have versus a predictive model that have been nowhere in the ballpark of accurate. So how many deaths do they have? 19,410 out of 19 million people, which is a 0.1% chance of dying from COVID in the state of New York. And they have a 92% recovery rate. If you are indeed diagnosed with COVID-19, 92% of you will recover. So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death. When you bring up a system of lockdown, you automatically have to compare it to a system of no lockdown. Sweden and Norway. I'm Norwegian.
Norway has lockdown.
Norway has lockdown. Sweden does not have lockdown. What happened in those two countries? Are they vastly different? Did Sweden have a massive outbreak of cases? Did Norway have nothing? Let's look at the numbers. Sweden has 15,322 cases of COVID. They did 74,600 tests, which is 21%, similar to the other countries, 21% of all those tested came up positive for COVID. What's the population of Sweden? About 10.4 million. So if we extrapolate out the data, about 2 million cases of COVID in Sweden. They did a little bit of social distancing. They would wear masks and separate. They went to schools, stores were open. They were almost about their normal daily life with a little bit of social distancing. They had how many deaths? 1,765. California's had 1,220 with isolation. No isolation, 1,765. We have more people. What I'm getting at is millions of cases, very small death. Millions of cases, very small death. This is what we're seeing everywhere. Norway, its next door neighbor. This is where I come from. These are two Scandinavian nations. We can compare them as they are similar. Let's look at the data. Norway, 7,191 cases of COVID. Total COVID tests, 145,279. So they came up with 4.9% of all COVID tests were positive in Norway. Population of Norway, 5.4 million. So if we extrapolate the data as we've been doing, which is the best we can do at this point, they have about 1.3 million cases. Now their deaths as a total number were 182, fairly small, but statistically insignificant from 1,700, you realize. Millions of cases, small amount of deaths. 1,700, 100, these are statistically insignificant. So you have a 0.003 chance of death as a citizen of Norway and a 97% recovery. Their numbers are a little bit better. Does it necessitate shutdown, loss of jobs, destruction of the oil company, furloughing doctors? That's the question I have for you. And I think the answer is going to be increasingly clear as we move through this data.